Hi, Assalamu alaikum and good evening everyone. Thank you for visiting my channel again. Abdurrahim here with you. So we are going to start our next video. Today we are going to discuss about the circulatory system of the heart. We are not going to discuss about the minute arteries or veins or capillaries. We are going to discuss the major arteries and veins, and also we will discuss the internal circulation of the heart. If we talk about the circulatory system, there are mainly two circulatory systems running in our body. One is a systematic circulation and one is the pulmonary circulation. Pulmonary circulation is a circulation between the heart and lungs. Okay, so the blood goes from the heart to lungs and then comes back from lungs to heart. This is called pulmonary circulation. Okay, the next thing is the systematic circulation. Systematic circulation means that the blood which goes from the heart to all over the body. Okay, that's the called systematic circulation, and also blood comes back from the body to the heart. This also comes into it. So there are mainly two types of vessels. One is the artery and one is vein. And generally what we call it that the artery takes oxygenated blood and vein takes deoxygenated blood. But this formula or this definition doesn't work very well in pulmonary circulation, because in pulmonary circulation, I will explain you later on that in pulmonary circulation you will see that the oxygenated blood is in the veins and deoxygenated blood is in the arteries. So the best definition would be that any vessel which are arising from the heart and taking blood from the heart is known as artery, and any vessel which is coming towards the heart or bringing the blood towards the heart is known as veins. So that's a better definition for artery and vein. Anyway, now we are going to start our circulation system. So as I told you in the last video that the heart is divided into two sides. One is the right side and one is the left side of the heart. So first we will describe about the right side. Okay, so what happens is that the blood throughout the body, the deoxygenated blood from all over the body, comes back into the right atrium. But how it comes back? From our lower limbs, like from abdominal organs and the legs, all the blood accumulated in a main vessel which is called inferior vena cava. Then this blood from inferior vena cava drops into the right atrium. Then from upper limbs like head, shoulder, face, this all deoxygenated blood goes and drains into the superior vena cava, and then superior vena cava connects it with right atrium, and the blood goes into the right atrium. So the deoxygenated blood from the inferior vena cava and superior vena cava reaches to the right atrium. And from the right atrium, at the end of right atrium, between the right atrium and right ventricle, there is a valve. We call it tricuspid valve. Okay, so the tricuspid valve is closed at that time and atria is relaxing, and it receives blood from inferior vena cava and superior vena cava. And then when the tricuspid valve opens and the ventricle starts relaxing, when ventricle starts relaxing, it receives blood from the right atrium. Okay, so all the blood goes into the right ventricle. This is deoxygenated blood again, okay, through the tricuspid valve. And now when the right ventricle gets filled and it contracts, then it sends the blood to the next chamber or the next artery, which is pulmonary artery. Okay, so right ventricle contracts, there is a valve between the right ventricle and the pulmonary artery. It's known as pulmonic valve. So the blood goes from the right ventricle to the pulmonary artery. We also call main pulmonary artery, pulmonary trunk, whatever you call it. This is the main pulmonary artery. Then it divides into two main branches, which is right pulmonary artery, which goes into the right lung, and left pulmonary artery, which goes into the left lung. Okay, so these are the two pulmonary arteries which takes the blood, and then it further divides into smaller and smaller vessels. Okay, capillaries and then capules, and these all things. When we take oxygen inside, that blood gets oxygenation there from the lungs, so all the blood comes into the lungs. Okay, so now from the lungs, when the blood gets oxygenated, it goes back towards our heart, but this time it goes to our left heart. Okay, you notice one thing, that deoxygenated blood came from the pulmonary artery, okay, towards the lung. So arteries carries deoxygenated blood and comes to the lung. And now once the blood gets oxygenated, okay, it goes back towards our heart through pulmonary veins towards the left heart. Okay, so 4 pulmonary veins, 2 upper pulmonary vein, 2 right upper and right, 2 upper, 1 is right upper, left upper, and 2 lower, 1 is right lower and 1 is left lower. So 4 pulmonary veins drain into the left atrium. So all that oxygenated blood from the lungs comes and drains into the left atrium. So when the left atrium is relaxing, it receives all the blood from the veins, then it contracts. When it contracts, it sends the blood to the to our left ventricle. There is a valve between left atrium and left ventricle. It's known as mitral valve. Okay, so mitral valve opens, the blood comes from the left atrium to the left ventricle. Okay, left ventricle is our main chamber. Okay, whoever are the patients, you come to know, or your heart's pumping power or ejection fraction is 50%, 60%, or these numbers. This is mainly, we are talking about your left ventricle. Left ventricle is your main pump, which pumps the blood to the body. Right ventricle is also a pump, but that pumps the blood to the lungs. Okay, so here we come. So the blood is in the this oxygenated blood now is in the left ventricle, and when left ventricle contracts, it sends the blood to the aorta. Okay, so that just between the left ventricle and the aorta, there is a valve, we call it aortic valve. Aorta is the main artery which takes the blood to all over the body. Okay, so it has different parts, like from where it's going, we give it different name. Like for example, it comes out of the heart, we call it ascending because it goes up first, so we give it ascending aorta. Then it makes a U-turn. Okay, so we call it arch of the aorta, and when it comes to the arch, it gives different vessels towards our right side, brachiocephalic artery, right brachiocephalic artery. Then it gives branches to the left side, which is left common carotid, left subclavian artery. Then it goes down further and it reaches to the abdomen, and it gives branches to all over the organs in the abdomen. Then it reaches till the end, and then it divides into two with its iliac arteries. Okay, right iliac and left iliac arteries. Okay, so this is how the circulation goes on. Now I will show you on the system, on the picture, so you will understand it better, whatever I told you. Okay, so let's come on to the computer now. Okay, so here you are. You see this is our right atrium. So this is inferior vena cava, this is superior vena cava. They drain into the right atrium. This is our tricuspid valve. Okay, so all the blood comes into the right side. Okay, this is the right side. So you also notice that the right side of the heart is anteriorly, and this is the left side which is posterior towards the heart. Okay, so you keep this one in the mind as well. So then this one is your pulmonic valve, and then the blood goes into this pulmonary artery, and then it divides into two. One is your left pulmonary artery, and the other one goes here, which is your right pulmonary artery. You see here, it goes from the back here. Okay, then the blood goes into the lungs. For example, look at this picture. Okay, from the right ventricle, it is the main pulmonary artery. This is right, this is left, and the blood goes into the lungs. Okay, now from the lungs, you see 4 pulmonary veins comes and drains into the left atrium. Okay, let me show you. This is our left atrium. 4 pulmonary veins comes and drains into this left atrium. Then this is our mitral valve on the left side. So in the left side, between the atria and ventricle, the valve called as mitral valve. So this is mitral valve, and this is left ventricle. Left ventricle is bigger than this, but why we see it smaller here? Because it's on the posterior side, so it covers this all area behind, but it's not clear here. Okay, so this is left atrium, and then there is this valve. You see on the back here, this is the aorta. This is the valve here. We call it aortic valve. This is the aortic valve here. And then this major red artery, which is, you see, coming back from here, this is the aorta. Okay, so the aorta goes up. Okay, and then this gives first branch. This is the first branch, which is called brachiocephalic artery. So this is the brachiocephalic artery, which gives further branches. Like on the right side, the carotid artery, subclavian artery, these are the branches of brachiocephalic artery. But on the left side, there is no brachiocephalic artery. So on the left side, if you go, you see the left common carotid is arising from the aorta. This is your left common carotid artery. This is your left subclavian artery. So they are directly arising from the aorta. Just keep in mind, on the right side, you have the main artery, which is brachiocephalic artery, and then it divides into it gives the branches of right common carotid and also the right subclavian artery. But on the left side, your common carotid and subclavian arteries are arising directly from the aorta. Okay, so then it makes a, so this is your ascending aorta. Okay, this is your arch of the aorta, and in the arch you will see all these branches, and after the subclavian it gets to a descending or thoracic aorta. So this is the thoracic aorta. As soon as it comes out of the thoracic cavity, we call it abdominal aorta, and then it goes further down. Okay, same thing you can notice here. So you see, this is your left ventricle. Here should be your aortic valve. This is your ascending aorta, brachiocephalic, left common carotid, left subclavian artery, and then this is your descending or thoracic aorta, and then as soon as it reaches in the abdominal cavity, you call it abdominal aorta. So this is the main circulation of the heart. So you need to keep it in the mind, because this one plays a very important role in echocardiography. So you need to keep this all information in your mind, because you are going to use it like every day in every patient. Okay, so if you will understand it better, I know it's not tough, it's just you need to understand it. If you will understand it better, it will help you a lot. Okay, thank you very much. Keep sharing and subscribe, and we'll see you in the next video soon. Thank you. Bye bye.